Good day everyone, I am Brace Badar, a respiratory therapy student at Mary Chiles College. As a respiratory therapist, we need to protect our hands to prevent the spread of respiratory infections such as rhinovirus, influenza, parainfluenza, mumps, measles, coronavirus, adenovirus, human metapneumovirus, as well as the respiratory syncytial virus. And for today's video, we are going to discuss and also to demonstrate on how to properly wear sterile gloves as well as proper way of washing our hands. As an individual, one of the key factors that keep us healthy is by washing our hands properly. The hand hygiene as well as the gloving are two procedures that mainly prevent the spread of pathogens or harmful microorganisms as well as the infectious diseases. The sterile gloves, like this, is used to reduce the infections coming from communicable diseases. So these two procedures are primary measures that help us to reduce the risk of transmitting infection between patient and the healthcare professionals. Touching objects like this with possible contamination of germs, bacteria, as well as infection or pathogen in general in the surface of our eyes, our nose, our mouth, as well as eating or drinking without washing our hands could lead to illness. That's why it is important for us to properly wash our hands to avoid having this kind of pathogen that could avoid the contamination, hospitalization, as well as death. There are key times to when we are likely to get or to spread germs. The first one is before, during, and after preparation of food. The second one is before and after eating food. The third one is while taking care of someone at home who is sick with the symptoms of diarrhea as well as vomiting. The fourth one is after taking the toilet. And the fifth one is after changing a diaper of an infant or an adult who cannot handle his or herself, as well as a child who has just finished using the toilet. The sixth one is to when we are throwing garbage, as well as the seventh one when we are blowing our nose, sneezing, or touching someone's hand. The World Health Organization releases the 5 moments to when a healthcare professional needs to perform hand hygiene. The first one is before touching a patient. The second one is before clean or aseptic procedure. The third one is after body fluid exposure or risk. The fourth one is after touching a patient. And the fifth one is after touching the patient's surroundings. Okay, so let's proceed with the demonstration of how to properly wash our hands. So the first step that we need to do is to wet our hands with water and apply soap. The second step that we should do is to rub our hands palm to palm like this. And the third step is using your right palm over the left dorsum with finger interlace and vice versa. The next step is palm to palm with finger interlace. Okay, so the next step is the back of the finger with opposing palm with finger interlace like this. So after doing this, rotational rubbing of the left thumb clasp in the right palm like this, and vice versa. The next step is rotational of backward forward with finger clasped together, vice versa. And the last step is to rinse with water. After rinsing your hand with water, make sure to use a single-use towel in order to keep your hands clean after the procedure. As we continue, I will teach you on how to properly wear your sterile gloves. But before that, we need to unbox this sterile latex surgical gloves. By the way, the difference between latex glove itself and latex-free gloves is that the latex-free is way more durable and they will have the function of reducing the risk of infectious, transmittable, or communicable diseases. Okay, let's try to open the package. The first thing that you will see is the package of the sterile gloves, as this. Okay, before opening the package, we need first to sanitize our hand or wash our hand with soap and water. Okay. Now, the step one is to peel down to open. So you need to open this, and please make sure that the area of you're going to open this package is clean or sanitized. Okay, peel down to open. Then get the package, the inner package containing the sterile gloves, and make sure not to touch the sterile area so that you would not contaminate the sterile gloves. So you can see here right and left. Okay, so open this using your two fingers. Okay, slowly open the package to not contaminate the sterile gloves. The next thing that you will do is using your non-dominant hand, you will need to pick this we call this right hand sterile gloves and do this and slowly insert your hands on the sterile gloves. Okay, make sure not to touch the sterile area. Okay. So it's already in, so do not touch this area because it is the sterile part. So using your two fingers from the dominant hand, insert it to this opening at the left sterile glove, and same procedure, so insert your fingers to the package and do not touch the sterile part, but you can touch it using the sterile to sterile area. So adjust your gloves now, make sure that there's no space for it to make a bubble. Okay, and make sure not to touch the non-sterile area using the sterile gloves. Okay, so as you can see, it is not perfectly fit on my hands because this is not my size, but it's done. So the proper way of wearing sterile gloves is already done. Now to remove this, okay, you need to use your non-dominant hand to get the sterile part. Make sure not to touch the inside of the gloves because it is not a sterile part. Okay, using your thumb and the index finger, slowly remove it and do not touch the inside. Okay, and make sure that it is like this. Okay, close it down like this, and using your 2 fingers from the dominant hand, insert it to the inside wherein it is not sterile, and then put it on back here and properly dispose it at a place where people cannot reuse it again, because it is already contaminated, especially when we are dealing with patient with communicable diseases. That's all. 난 남이 되고